Pain in the butt? Have you ever sat down and your tailbone said, absolutely not? If sitting feels like you're parked on a pebble, your tailbone might be irritated. That sharp, deep ache right at the bottom of your spine can make sitting, driving, or even standing up feel absolutely miserable. Today, I'm diving into tailbone pain, also called coccydynia, why the tailbone becomes painful, the most common hidden causes, how to make sure it is the coccyx and not something else like, say, sciatica or piriformis syndrome, and the simple things you can do to calm it down. This is Dr. CeCe. Let's dive in. Your tailbone, or coccyx, is the small triangular bone at the very bottom of your spine. It's made up of about 3 to 5 fused vertebrae and serves as an attachment point for several muscles and ligaments, including parts of the pelvic floor. Think of it like the keystone at the base of your spine. Small, but important for balance, sitting pressure, and pelvic stability. When it gets irritated, even simple things like sitting in a chair can feel like sitting on a rock. There are 5 common causes of tailbone pain. The first are falls or direct trauma. One of the most common causes is simply falling on your butt. This can lead to bruising, ligament strain, small fractures, and joint irritation. Sometimes the pain shows up weeks later after inflammation settles into the joint. Next, just too much sitting. Long hours sitting can compress the coccyx. This is especially common with desk work, driving, poor posture, and slouching or posterior pelvic tilt. When you slump, the coccyx becomes a pressure point instead of a support structure. Next is childbirth. This is the big one, because during delivery, the coccyx can be pushed backward. In some cases, this leads to ligament strain, joint irritation, persistent sensitivity, and postpartum tailbone pain is more common than many people realize. Next, pelvic floor tension. Because the coccyx connects to the pelvic floor muscles, tightness or overactivity in these muscles can pull on the tailbone. This means tailbone pain may actually be coming from muscle tension, stress patterns, or protective guarding. Your nervous system sometimes keeps the muscles in a low-grade contraction. Last, but certainly not least, joint mobility problems. The coccyx actually moves slightly when you sit and stand. If it becomes too stiff, too mobile, slightly misaligned, that joint irritation can create persistent pain. Symptoms of tailbone pain typically include pain when sitting, pain when standing up from sitting, tenderness directly over the tailbone, pain during long car rides. Some people even feel pain when leaning backward or with certain core muscle exercises, and using hard chairs. Pain in your butt or down your leg can come from 3 very different problems. Is it sciatica, coccydynia, or piriformis syndrome? Let's quickly break down the differences. With sciatica happens when the sciatic nerve becomes irritated or compressed, often in the lower spine. Common symptoms are pain that travels down the leg, burning, tingling, or numbness, pain that starts in the low back or the glute. The key clue is the pain radiates down the leg, sometimes all the way into the foot. With tailbone pain comes from irritation of the coccyx specifically. Common symptoms include pain directly at the tailbone, pain when sitting or leaning back, and tenderness if you press on the tailbone. Key clue is the pain is very localized at the bottom of the spine. It usually doesn't travel. With Piriformis Syndrome occurs when the piriformis muscle irritates the sciatic nerve as it passes through the glute. Common symptoms: deep buttock pain, pain when sitting for long periods, sometimes pain traveling partway down the leg. A key clue for this one is the pain is centered deep in the glute, not the tailbone. Think of it like different pain zones. Tailbone pain is at the bottom of the spine. Piriformis syndrome is deep in the glute. Sciatica, it's nerve pain traveling down the whole leg. Different causes, different solutions. Here are some simple ways to relieve tailbone pain. Number 1, use a tailbone cushion. If sitting is painful, a tailbone cushion or leaning slightly forward when sitting may help. Small mechanical changes can make a huge difference. A tailbone cushion is a donut or wedge cushion that removes pressure from the coccyx while sitting. This shifts pressure away from the coccyx and onto your other sitting bones. Padded shorts, also known as butt pads or crash pads, are also strongly recommended to cushion the tailbone, especially when sitting. Number 2, fix sitting posture. Try this simple reset. Sit tall, tilt your pelvis slightly forward, and stack your ribs over your pelvis. This also shifts weight off the coccyx. Number 3, gentle mobility. Slow pelvic rocking or cat-cow movements can help restore natural motion in the lower spine. Motion helps calm irritated joints. Let's try 3 simple pain relief stretches that can help take pressure off the tailbone and calm things down. These are gentle stretches designed to relax muscles around the pelvis, hips, and the lower spine. Always move slowly and stop if anything causes sharp pain. First stretch is the figure 4 piriformis stretch. The piriformis muscle sits deep in the hip and can pull tension into the tailbone region. It also sits near the sciatic nerve, which is why hip tension sometimes travels into the glutes or tailbone. Here's how to do it. Lie on your back, cross one ankle over the opposite knee, and pull the bottom thigh towards your chest. Hold for 20 to 30 seconds. You should feel a stretch in the hip and glute, not the knee. Now you can switch sides. Now, the piriformis stretch is great. You can do this in 3 different ways. You can do it sitting, standing, or laying down. Stretch number 2 is a child's pose, pelvic floor release. Because the tailbone anchors part of the pelvic floor, relaxing these muscles can reduce tailbone tension. Here's how to do it. Kneel on the floor, sit your hips back towards your heels, and reach your arms forward. Now let your belly soften toward the floor. Take slow, deep breaths into your ribs and belly and hold for 30 to 45 seconds. Think of this as a nervous system reset for your pelvis. Last stretch is a knee to chest decompression stretch. This stretch gently opens the lower spine and reduces pressure through the sacrum and tailbone. Here's how to do it. Lay on your back and pull both knees towards your chest. Now wrap your arms around your legs and gently rock from side to side. Hold this for about 30 seconds. This movement helps the lower spine and the sacrum relax. Try these stretches once or twice a day if you're dealing with tailbone pain. Your spine likes motion. Give it a little, and it often gives relief back. Number 4, Address pelvic floor tension. Breathing exercises that expands the lower ribs and belly can really help the pelvic floor relax. The state of your nervous system often influences pelvic floor muscle tension. Let's do a gentle nervous system reset for the coccygeal plexus and tailbone. First, let's set the tone. Before we move, let's send one message to the nervous system. You are safe. You don't need to fix anything. We're just creating space and comfort. Now, choose a position that feels supportive. Lying on your side with knees bent, on your back with knees supported, or seated on something soft. Let the tailbone feel unpressured. We're going to start with coccyx unloading and breath awareness. Place one hand on your lower belly and one on your chest. Inhale gently through the nose, exhale slowly through the mouth. Imagine the breath traveling downward and wide, not forced. On the exhale, picture the tailbone softening, not tucking, not stretching, just ungripping. Here's your cue. Nothing needs to move for this to work. Next, let's try pelvic floor drop breathing. On each inhale, feel the ribs expand. Feel the lower belly gently rise. On each exhale, imagine the pelvic floor melting downward, like warm sand settling. No pushing, no bearing down. If helpful, here's a cue. The pelvic floor follows the breath when the nervous system feels safe. Next, let's do some micro-pelvic rocking. If you're laying down, very gently rock the pelvis a few millimeters, one breath to tip and one breath to return. This is not a stretch. This is a conversation with the nervous system. If seated, gently sway forward and back just enough to notice the sitting bones shift. Keep it slow, keep it small. If there's pain, make it smaller or a pause. Next, we're going to do a coccygeal soothing visualization. Stillness again. Bring awareness to the tailbone area. Imagine warmth, soft light, or gentle spaciousness. Say quietly or internally, this area doesn't need to protect right now. Let the nervous system receive the message. Take one final breath. Notice contact with the surface beneath you, the weight of your body being supported. Gentle signals, repeated, often are more powerful than force. Number 5, gradual return to movement. Avoiding movement completely can make pain linger longer. Gentle walking and movement usually helps circulation and recovery. We call this active recovery. You should seek professional help and get evaluated if the pain lasts longer than 6 to 8 weeks, pain started just after a significant fall or trauma, or you notice numbness or bowel and bladder changes. Now, chiropractic is great for tailbone pain relief. I myself have done many coccyx adjustments with successful results. Your chiropractor may use their hands, a drop table, or a little tool called an activator for this very specific adjustment. A clinician can evaluate the coccyx, surrounding joints, and pelvic muscles. They may need to take diagnostic imaging like X-rays or MRI. But here's the tricky part. The findings for this area on diagnostic imaging is often normal, which is why these symptoms are frequently misunderstood and misdiagnosed. The tailbone may be small, but tailbone pain can disrupt a lot of daily life. The good news is most cases respond well to simple mechanical changes, movement, nervous system calming strategies, and chiropractic care. If you want to know more about your coccygeal plexus, the network of nerves that come from your coccyx, check out my lecture on the coccygeal plexus, located in the spinal plexus playlist. Thank you for watching. Like and subscribe to the channel for more videos on spine health, posture, and pain recovery. And remember, your spine is designed for movement, not suffering. This is Dr. CeCe. See you next video.